Bahamas have been working very hard to address the situation of HIV/AIDS in the Commonwealth of the Bahamas.
So we are very aggressive with moms during pregnancy. The first thing that we do is that we encourage moms to have early bookings within the first trimester to antenatal clinic. Once moms arrive at the antenatal clinic, we aim to do all of their relevant labs at their first visit.
Usually when the patients comes, usually we give the investigations and everything on the first visit. So we follow all the labs and everything immediately depending upon the results. So we immediately implement the treatment.
So in the Bahamas, all women seeking and accessing antenatal care services from the public sector have access at no cost to them.
Of note, also, I would like to say that the meds are completely free, as is the testing, as is antenatal care.
The Pan American Health Organization, PAHO, congratulates the government and people of the Bahamas on achieving the elimination of mother-to-child transmission of HIV.
A lot of people have been involved in us achieving this great milestone. Our nurses and our public health system, all of our nurses and doctors in our tertiary healthcare system, and by extension, all of the clinics that spread throughout our archipelago. The issue of reporting has always been a challenge, and with the implementation of new IT systems, we are now in a position where this is becoming a reality for us. And PAHO, WHO, and the entire team from abroad has been working very closely with us in order for us to accomplish this wonderful milestone.
The Bahamas has a very robust and good antenatal program, and the health programs are good, including infectious diseases clinic and the HIV clinic. And I think the services are excellent. What we need to strengthen is documentation.
And so one of the main solutions that we came to were to host a training with a lot of the midwives and nurses at the clinics.
Well, training is paramount. In order for us to maintain this recognition, it requires massive training throughout the country, particularly in our public healthcare systems and our primary healthcare clinics. It's important for us to have the necessary medication training as well as digital platforms for monitoring and documenting.
That we have the capacity within country, we have the level of partnership and camaraderie among stakeholders to work together to provide the evidence and to put in the steps that are necessary to document and to sustain elimination of other agents on the elimination agenda.
I'm a proud Bahamian, and historically the Bahamas was the first English-speaking Caribbean country to have a PMTCT program. My predecessor, Dr. Gomez, who's passed away sadly, he started that program and he shared the knowledge with other Caribbean countries. And so it will be a red letter day in the Bahamas. We'll be smiling from ear to ear. We'll be very proud.
We celebrate because we realized that it would put us back on the map because we were pioneers in the fight against HIV, and so it will be a moment of great enjoyment and celebration for us.
We have started this work for a very long time. We are very comfortable with all of our patients coming through our doors, whether they are HIV positive or not, and so the validation will just tell us that we can continue doing the good work that we have started.
This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2030.
This achievement reflects strong political will and steady investment in primary health care. It also recognizes the dedication of health teams and of people living with and most affected by HIV, who work every day to ensure babies are born free of preventable infections.
As we look ahead, this milestone is not only a moment of national pride, but also an opportunity to build on this success. It should inspire continued progress toward eliminating mother-to-child transmission of syphilis and hepatitis B.
The Bahamas, these women, men and women who work for the National HIV/AIDS program, they have done this for decades, and I think it's high time that, they got that recognition for what they do, the lives that they've saved every day, and I personally appreciate what they have done, what we have all done working together, and I'm excited to see that, played out in the success of the validation.